Like a bridge over trouble. Vlogger ka, girl. Hi guys, it's your dental beshi, Dr. Mac Assis, and today it's all about bridges. If you're not already subscribed to this channel, please don't forget to click the subscribe button and hit the notification bell icon for future videos. Let's jump into it. So why would someone need a dental bridge? A missing tooth or a couple of teeth can affect you in so many ways, and a dental bridge can be the answer to that problem, including restoring your smile, restoring your ability to chew, readjusting your ability to bite to distribute your forces of chewing, restoring your speech and pronunciation, maintaining the shape of your face, and preventing your teeth from moving out from its proper position. But first, let's talk about Pontics. A Pontic is what replaces a missing tooth. It can be made up of gold, metal, or porcelain, so it blends well to the rest of the teeth. Saan siya kakapit? Now, what supports a dental bridge is what we call the abutment teeth. These are the teeth on both sides of the space. Yung nasa gilid. Now, we have 4 types of dental bridges. The traditional one, the Cantilever, the Maryland, and the Implant Supported bridge. The traditional one. It's the most common of all the bridges. It uses the teeth on both sides as support for the Pontic, which is usually made up of porcelain. It has a very high success rate, especially if the distribution of load applied to the teeth are balanced. The Cantilever. It's kind of the same with the traditional one, but I'm not a big fan personally because it only needs 1 tooth as support for the rest of the bridge. So parang nakahang lang siya. So sometimes nagsisiso siya, which makes this restoration fail. So yeah, not a big fan. The Maryland. It's just like the traditional one because it requires 2 teeth as abutment teeth, but unlike the traditional ones, this does not require a crown, a full crown. However, the Maryland only requires a metal framework, which is usually made up of, you guessed it, metal, and sometimes porcelain, which are bonded at the back of the abutment teeth. If cared for properly, this can last you a long time, but most of the cases that I see, not so lucky. So nagfi-fail. Lahat naman talaga magfi-fail if hindi mo inaalagaan. Relationship nga nagfi-fail, di ba? Pag hindi mo inaalagaan. Just saying, sis. The Implant Supported Dental Bridge. So sophisticated because implant supported siya, di ba? As the name implies, this utilizes the use of implant as support and not crowns or frameworks, just like the Maryland, the Cantilever, or the traditional ones. This uses an implant as support for the bridge. Paulit-ulit, kung hindi mo pa magets, hindi ko na maintindihan. Ewan ko na lang sa'yo. Typically, a single implant should replace a missing tooth. But in cases with more teeth missing, you need more implants. Then a Pontic can be suspended in between 2 implants. Mahal. Considered as the most stable system, the implant-supported bridge typically requires 2 surgical meetings for it to finish. 1 to embed the implant in the jawbone, sasaksak siya doon, yeah, and 1 to place the bridge. Now this means it's a bit lengthy, but you know, good things happen to those who wait and have budget. Speaking of budget, let's talk about the cost. Now this is a controversial topic because of the so many variables that can affect this. The number of teeth to be replaced, the material of choice, the complexity of the case, the difficulty of placement, additional treatments of other dental issues such as gum diseases and bone problems, and also your geographic location. Yes, mga kababayan, where you are located can also affect the cost of your dental procedure. Siyempre, kung nakatira ka sa Mindanao tapos magpapagawa ka sa Abu Dhabi, mas mahal yun. Di ba? Ang mahal ngayon, ang mahal ng ticket. May visa pa, may pocket money pa, mag-hotel ka pa. So with all these factors brought together, a dental bridge can typically cost between 3,500 pesos all the way to 250,000 pesos per tooth. Again, depending on the factors that I mentioned. So if you're missing a tooth or a couple of teeth and you think that dental bridge is the solution to your problem, I hope that this video helped you decide and put things into consideration. So if you think that this video was helpful, don't forget to click the subscribe button and hit the notification bell icon so you'd get notified every time I upload a new video. Thank you so much for watching. Once again, this is your Dental Beshi, Dr. Mac Aziz, and remember, make good choices. Vlogger ka, girl.